Oncologist and Endoscopic Surgeon at Paras Bliss Hospital Panchkula. Today I'll be discussing with you women cancers, their prevention and management. So first of all, we'll discuss what is cancer. Cancer is a disease in which abnormal cells in the body divide and grow out of control. Cell is the basic unit of any living object. Our body is made up of billions of cells. When these cells replicate and do not die according to their normal course, there is an overgrowth, and this is known as carcinoma. When these abnormal cells spread to other parts of the body, this is known as metastasis. Why we are discussing carcinoma? This is the Indian scenario. There are 8 lakh cases every year, nearly 2.5 million existing cases in India, and 4 lakh deaths occurring due to cancer. The cancer incidence has been estimated to be around 70 to 90 per 1 lakh population. Cancer is always named for the organ or the part of the body where it starts, even if it spreads to other body parts later. When it starts in the uterus, that is the womb, it is known as uterine cancer. When it starts in, it is known as cervical cancer. And when it starts in the breast, it is known as breast carcinoma. These are the leading sites of cancers in females in India. Only I'm specifying the female cancers of the genital tract. First is the breast carcinoma, then is the cervical, then ovarian, and the last is the uterine carcinoma. First, we'll discuss the breast cancer. Nearly 75,000 of breast cancers are reported in India every year. The chance that a woman will die from breast cancer is about 1 in 37, that is about 2.7%. What are the warning signs of breast carcinoma? If you notice a new lump in the breast or underarm, or there is thickening or breast, irritation or dimpling, or redness or flaky skin of the breast, or if you notice peeling of the nipple or pain in the nipple area, discharge from the nipple other than the breast milk, including blood, or it may be blood-stained discharge, any change in the size or shape of the breast, pain in any area of the breast. Whenever these signs appear, one should go for evaluation by a doctor. So what can be done to prevent breast carcinoma? First is breast self-awareness. You should be very familiar with your breast and examine them regularly to know what is the texture and shape of your breast. Breast self-examination should be done once a month and generally after your periods are over, so that the breasts are not swollen or tender. If you notice anything abnormal amongst the signs mentioned earlier, you should go for a clinical breast examination, which is done by a doctor to diagnose any lump or any other abnormality in the breast. Along with these, we have radiological investigations like breast ultrasound, a mammogram. A mammogram is in the way in which we use X-rays to diagnose the details, to look into the details of the breast and diagnose any problem. Then we have the breast magnetic resonance imaging, that is the breast MRI, which again enhances the views and we can view every minute detail of the breast. A mammogram is generally recommended according to the guidelines. After the age of 40 years, every 2 years you should go for mammography. Apart from these radiological investigations, if any abnormality is found, then we go for a biopsy in which fluid or tissue is taken from the breast and it is sent to the laboratory for further examination. How can we prevent breast carcinoma? Early pregnancy and breastfeeding both lower the estrogen levels and are hence very useful in preventing breast carcinoma. In patients who have high risk of breast carcinoma with a strong genetic history, we can offer them prophylactic mastectomy, that is removal of the breast, but this has to be done only after the cancer risk assessment oncologist and proper counseling of the patient. Ovaries are mainly responsible for producing the hormone estrogen, which is responsible for breast carcinoma. To lower the estrogen production from the ovaries, we can offer prophylactic oophorectomy, that is removal of the ovaries even when there is no sign of carcinoma, or radiotherapy, or by certain drugs which prevent the functioning of the ovary and hence the estrogen production. But again, this has to be done after your whole cancer risk assessment and proper counseling by an oncologist. Exercise and avoiding alcohol abuse are another factors which play a major role in preventing breast carcinoma. Now coming to cervical cancer. Nearly 75,000 Indian women die annually from cervical cancer. More than 200 women die every day and 8 women die every hour. Every 7 minutes, a woman dies of cervical carcinoma. If I talk of the world scenario, 1 in every 4 women dying of cervical carcinoma is Indian. Now, what causes cervical cancer? The main cause is a virus. This is known as the human papilloma virus, which spreads through sexual contact. Now, what are the symptoms of cervical cancer? There can be abnormal vaginal bleeding, like bleeding after vaginal sex, bleeding and spotting between periods, periods that are longer or heavier than usual, and bleeding after menopause. There can be abnormal vagina, which can be foul smelling or blood-stained discharge. There can be discomfort or pain during intercourse, pelvic pain. Menstrual cramps are usually normal, but however, if there is pain that is persistent, then you should go for an evaluation. There may be lower back pain and loss of appetite and unexplained weight loss. One very important thing to remember here is that if you have 1 or 2 of these warning symptoms, that doesn't mean that you have cervical carcinoma. But yes, it definitely should ring a bell that now is the time to go for an evaluation. Now, what can be done to prevent cervical cancer? One is Pap Smear. Then we have the HPV DNA test, visual inspection of the cervix, then colposcopy, in which we take a magnified view of the cervix if there is some abnormality in the Pap smear or HPV DNA test, and the last is to get vaccinated. Now, what is a Pap smear? The abnormal change in the cells of the cervix can be detected early before they turn into cancer. This can be done by a Pap smear. It is done during a pelvic examination. The doctor uses a small brush to take a small sample of cells from the cervix and sends it to the laboratory for further examination under a microscope. Then coming to the HPV DNA, we have talked already about the human papilloma virus, and a HPV DNA test checks for the genetic material, that is the DNA of the human papilloma virus. Again, it detects the high-risk types of HPV DNA. We have both low-risk and high-risk type of HPV DNA. The high-risk ones are the ones which are responsible for causing cervical carcinoma in around 70% of the cases. This HPV DNA test may be done along basis, which is called as co-testing, or by itself alone. And it is done in the same way, in the same pelvic examination as we are doing for the Pap test. Now coming to the HPV vaccine. Routine vaccination of females is done between the ages of 9 to 13 years, as early as 9 years. It is best effective when given before the onset of sexual activity. Our Indian guidelines recommend that we can vaccinate females for HPV vaccine up to the age of 5 years. We have two types of vaccine available in India as Cervarix and Gardasil. Prevents HPV type 16 and L carcinoma. Gardasil is a quadrivalent vaccine which prevents against HPV type 6, 11, 16 and 18, and also provides additional protection against warts and anal and vaginal carcinoma. The schedule is 3 shots over 6 months. If your daughter is less than 15 years of age, only 2 doses of HPV vaccine are sufficient, that is 0 and 6 months apart. Now, what can you do to prevent cervical carcinoma? If you are sexually active, you can get your first Pap smear at the age of 21 and then every 3 years. Get a Pap every day or simultaneous Pap and DNA which forms the coating every 5 years. Get vaccinated against HPV vaccine. Get sexual intercourse until the late age that you can avoid having intercourse with people who have multiple partners. Then, use of condoms to reduce the risk of HPV. It has been shown that men who are using condoms have a lower risk of transmitting the HPV to their female partners. Then again, having fewer sexual partners and avoiding drug and alcohol abuse. Now coming to uterine cancer, the female genital tract in the Western world. It is the fourth most common cancer in women after breast, lung and colorectal. In India, it is the third most common genital tract malignancy after cervical and ovarian malignancy. Now, who is at risk for uterine cancer? Females who are obese, who are nulliparous, that is, who have never been given birth to a child, then who are taking estrogen by itself for hormone replacement therapy during menopause, then having close family members who have had uterine colon cancer. If you have had trouble getting pregnant or have fewer than 5 periods in a year at any time in your life before starting menopause, you are at risk. Then those who are taking tamoxifen, which is a drug used to prevent or treat certain types of breast carcinoma. Now again, the symptoms of endometrial or uterine carcinoma. First is postmenopausal bleeding, that is bleeding occurring after the cessation of your menses. Menopause is considered when there is 1 year of full cessation of periods. Or if you have bleeding between periods or any other bleeding that is longer or heavier than normal. Then abnormal vaginal discharge, which may be foul swelling or blood-stained discharge. Then again, pain or pressure in your pelvis. For the screening, that is detection of carcinoma when there is no evidence of disease, there is no simple and reliable way to test for uterine cancer in women who do not have any signs or symptoms. The Pap test does not screen for uterine cancer. So what can be done? We have the transvaginal ultrasound, in which a probe is introduced into the vagina and we examine the uterus, tubes, ovaries and the urinary bladder. Then we have the endometrial sampling, in which tissue is taken from the endometrium, that is the innermost lining of the uterus, and sent to laboratory for further evaluation. Then finally we have the hysteroscopy, in which a scope is introduced into the uterus and we can view the whole of the inner lining of the uterus for any abnormality. The magnification provided by the hysteroscope is magnificent. So what can be done to prevent uterine carcinoma? First, pregnancy and breastfeeding. Again, the estrogen levels are lower in them and they help in preventing endometrial carcinoma. Then combined oral contraceptive pills have been shown to have a protective role. Third is physical activity and avoiding being overweight and quitting smoking. They play an important role in preventing. Now, what are the treatment modalities available with us to prevent carcinomas? Once diagnosed with a cancer, we have a number of treatment modalities. One first is surgery. Surgery in which we include is the removal of the carcinomatous tissue. All the surgeries done for cancer are extensive surgeries and need a lot of expertise. Second is chemotherapy, in which we are using a number of drugs that kill the cancer cells. Third is radiation therapy, in which we are using high energy X-rays to damage the carcinoma cells. Fourth is hormonal therapy. In the hormonal therapy, we are using drugs to act against the cancer cells, which are hormone dependent. Next is the biological therapy, in which we are using the body's immune system. We are using such agents which use the body's immune system to fight against carcinoma. Apart from these, we have palliative therapy, which is given for symptomatic relief to patients who have end-stage carcinoma, and we are not actually treating but just relieving their symptoms. The treatment modalities can be a combination of any two or three of these. A patient might go for surgery if it is operable, and then go for chemotherapy and radiotherapy both, or either one of the modalities. Or a patient might go for chemotherapy first and again go for surgery, then again chemotherapy. Now, which kind of treatment is right for a particular patient? For that, you need to discuss it with your oncologist. An oncologist is a specialist who is dealing with cancers. The treatment, of course, depends on the type and stage of the carcinomas. Early stage carcinomas can be dealt with easily and they have a good prognosis. So, thus to summarize, early detection of carcinomas has a very good prognosis and the treatment is most effective. You have to recognize the warning signs. The warning signs do not mean that you have cancer, but yes, they ring a bell that you should go for an evaluation now. Whenever gynecological cancers are found early, the treatment is the most effective one. Thank you.